Welcome to the Internal Medicine Program at Cleveland Clinic, Florida. I'm Darby Sider, the Program Director, and I'm here with Kristen Hager, one of our Associate Program Directors. We are honored to have you join us to learn more about our fabulous residency program.
The Cleveland Clinic is a nonprofit organization with facilities in Northeast Ohio, Central and Southeast Florida, Las Vegas, Nevada, Toronto, Canada, London, and Abu Dhabi. Our program started in 1996 when the program was located at a beachside hospital in Fort Lauderdale. Our Emeritus Program Director, Dr. Jose Muniz, led the program's move to a brand new hospital in Weston in 2001. New additions to the hospital have been a regular occurrence since then. Growth in our regional reputation has led to growth in our hospital footprint. We have a total of 258 beds, which includes a 24-bed observation unit, a 24-bed MICU, and a 24-bed SICU. All rotations are done here in Weston unless one chooses to go elsewhere for an outside elective. Our general internal medicine staff includes 18 Weston primary care physicians and 18 hospitalists, many of whom did their internal medicine residency training here. All of our staff are employed physicians with no outside practices to take us away from providing education. Despite being a relatively small community hospital, we have been recognized both regionally and nationally by U.S. News and World Report for our outstanding care. On the most recent ranking, we have been ranked number 1 in the South Florida region. Our gastroenterology department is ranked 30th in the entire country, and recognized as the top 10% in the country are the divisions of cardiology, geriatrics, neurology, pulmonary medicine, and urology. As you can see, we have staff in all the medicine specialties. We are currently performing liver, kidney, and heart transplants. Two years ago, we received long-awaited approval to expand our residency program. Between 2024 and 2026, we will grow from a 31 resident program to a 47 resident program. We currently have 43 residents as part of our internal medicine residency program. This includes 35 categoricals and 8 preliminary interns. We will have 39 categoricals in July 2025, bringing our total complement to 47. Anesthesia interns each spend 3 months doing medicine rotations with us. Our size and personal attention foster an impressive camaraderie amongst the residents, faculty, and staff. Despite our relatively small size, we do have numerous fellowship programs. Fortunately, the fellowships are not so large as to take away from opportunities from our residents. We have an excellent working relationship with all of the fellowship programs, which regularly match our residents into their programs, as well as assist us with research projects and teaching. We have numerous other ACGME accredited programs, as well as multiple other non-ACGME fellowships. I share this information to demonstrate again that we are not your typical community internal medicine program that stands alone, as they often do at many community hospitals. A pillar of the Cleveland Clinic's mission is to educate those who serve. We have many learners here, and we truly value the opportunity to teach. We are also affiliated with numerous medical schools, including locally, Florida Atlantic University in Boca Raton and Florida International University in Miami, and internationally Ross University and St. George's University. In addition, students from many other allopathic and osteopathic medical schools do elective rotations with us. Our residents play a very key role in educating the students both clinically and in didactics.
Choosing a residency program is a major life decision. Internship and residency are stressful, and there are a few factors which could help mitigate any additional stress. We appreciate how much more difficult your decision will be having to go through this process virtually. For those who have not had the opportunity to rotate here, once our rank list is submitted, we invite you to come visit to see what we're like in person. In the meantime, I'll share a few pearls in helping you make your decision. First, you should think about what kind of internal medicine program will provide you with the best opportunities for your future goals. Are you the kind of person who performs best amongst large numbers, under the radar, not seeking individual attention? Or do you desire to be a big fish in a small sea, have faculty know your name and welcome you into their office at any time with their open door policy and receive personal attention? If it's the latter, we fit the bill. If you're looking for a program that has a primary care track in which most of your PGY3 year is spent in the ambulatory center, as opposed to experiencing all facets of internal medicine, then this program is not for you. Here, you will be well prepared to practice primary care medicine, as 3 of us in leadership are PCPs, but all of our residents share equal time on the inpatient service, in the ICU, and in the ambulatory clinics, regardless of their desired post-residency plans. We do individualize which electives and specialty clinics you experience based on those postgraduate goals. We help develop well-rounded, comprehensively trained internists. Second, you need to consider where you want to spend the next 1 to 3 years of your life. Is geography important? Are you intolerant of cold weather? Do you suffer from Raynaud's? Do you dislike heat and humidity or are bothered by hyperhidrosis? Do you have family locally? And is that a good thing? Do you value the support system of having a family close by? Perhaps it's your in-laws who live down here and you prefer to leave the area. Be sure to consider location. Ultimately, choosing a residency program comes down to where you feel that you will fit in best. You should consider the overall culture and outcomes of the program. In the end, when you complete a categorical residency in internal medicine, you want to have the skills and knowledge to become an excellent internist, to pass the ABIM certifying exam, and to obtain the postgraduate position of your choice, whether that be fellowship or out in practice. As a preliminary intern, you want to develop the excellent foundation to support your future educational goals. We will now share some of our outcomes with you. We participate in the American College of Physicians annual in-training exam. We consistently score very well compared to programs across the country. Our 11-year rolling average for the ABIM certifying exam is 99%. For the most part, programs in South Florida do fairly well in passing the boards. This table shows the 3-year rolling pass rates for 2022 through 2024 for the programs in South Florida. In the past 15 years, of all of our graduates taking the ABIM certifying exam, only 2 did not pass on their first attempt. Our residents' success in obtaining fellowship positions is excellent. Cleveland Clinic is a name that is recognized internationally, thus opening doors for those who train here. Clearly, you need to do the work to support your credentials, and we assist in that by having research mentors, as well as providing education and elective time directed towards research beginning in the PGY1 year. The 2024 fellowship match was no exception. Our former chief resident and all 4 of the seniors who applied to fellowship matched. Our residents are currently getting advanced training at some prestigious programs, including Cleveland Clinic, Ohio, here at Cleveland Clinic, Florida, University of Florida, University of Chicago, Mayo Clinic, Jacksonville, University of Utah, University Hospital Cleveland Medical Center, Baylor, Oregon Health and Science University, Mount Sinai Medical Center, Miami Beach, and Baylor Scott and White in Texas. So what do we do to achieve such success? We truly value and prioritize education and consistency. We utilize MICSAP modules and the board review program developed by the American College of Physicians for ongoing review sessions. We have our core curriculum conference 5 days a week, plus additional case-based morning report-like conferences 3 days a week. During our academic half-days in the ambulatory block, we focus on outpatient topics, the QI process, safety and high-value care, as well as simulation and POCUS training. In addition to the typical internal medicine conferences, including Journal Club, Morbidity and Mortality, and Grand Rounds, we participate with the 4 Cleveland Clinic internal medicine programs in Ohio for joint conferences. This year's topics included medical billing and insurance and addiction medicine. We also host a 5-day internal medicine board review course each spring that was attended by over 500 graduating internal medicine residents this year, as well as by practicing physicians throughout the country. Highlights include daily high-yield sessions by Dr. Muniz, our Emeritus Program Director. We require our graduating PGY3s to attend. Finally, we try to be innovative and present evidence-based medicine in a learner-centered fashion. We are small enough that as our learners' needs shift, we adjust.
We don't feel 24-hour call places learners in a position to function at their best, so no shift is more than 16 hours. We follow a 6+2 schedule. You will have scheduled non-call time on your ambulatory block in addition to your elective time. We have a resident-led rapid response team that promotes autonomy and decompresses the floor teams. In conjunction with this, the residents learn about hospital operations, throughput, and decreasing readmissions. We pride ourselves on the personal attention to education that we achieve due to our small size and dedicated faculty. We have regularly scheduled visits to our simulation center during the ambulatory block to work on clinical, technical, and communication skills. You will have the opportunity to teach medical students in both direct patient care and with didactic sessions. There is no better way of cementing one's understanding of a subject than by teaching it to others.
To summarize, we are a true hybrid program, providing the diversity and severity of illness of patients at an academic medical center. The academic and research rigor is well balanced with the friendly, family-like atmosphere, personal mentoring, exceptional facilities, and supportive network of a community hospital. We could not be prouder of our exceptionally successful internal medicine residency. We truly do train superheroes.